So if you have diabetes, your primary care doctor or your endocrinologist tells you to get an eye exam. But why are they sending you to us, and what are we even looking for? Let me explain. So diabetes is a systemic condition that affects your whole body, and your eyes are no exception. Believe it or not, diabetes is the #1 cause of blindness in the working age population. A diabetic patient is twice as likely to develop cataracts, usually at an earlier age, but also twice as likely to have glaucoma, which can be a blinding disease if left untreated. In addition to cataracts and glaucoma, diabetes affects the blood vessels, especially the small ones. This means that all the blood vessels in the eye, which are the smallest in the body, get leaky. And when they get leaky, they cause bleeding and swelling in the back of the eye called the retina. This is going to affect your vision and can lead to permanent, devastating damage if left untreated. We do a dilated fundus exam where we examine the retina. We look for leaky vessels or swelling. If there's swelling in the retina, that tissue is separated from its blood supply. A tissue that does not get nutrition will die. So that's what we're looking for when we look at the back of your eye. Now, why is this important? Well, when we look at the back of the eye, it's the most non-invasive way we can see your blood vessels in your body. If it's happening in the eye, it's happening everywhere else. So it's a great indicator of how well your blood sugar is being controlled. From this information, your regular doctor, your primary care doctor, or your endocrinologist can adjust your blood sugar control. If there's bleeding in the eye, there's bleeding elsewhere in the body, so we need to get that under control. If everything is going as normal, we see you once a year. However, if we start to see diabetic changes happening in the back of the eye, we'll tend to see you twice to 3 times a year. And if there is a change, we can intervene as quickly as possible to preserve your vision. So if you learned something new, like, subscribe, and we'll see you in the next video.